Maybe it worked for you, and at some point, it's still not enough. And it's still not enough. This is why therapy fails. Lack of definition, what success looks like. If there is no connection, clinical hypnotherapy won't work for you, like any other modality. Hey, if you're new to me, my name is Eugene Berezin. I'm a registered hypnotherapist in the state of Washington. And my background is in psychotherapy. I worked as a therapist, so I know exactly um, how sometimes people might go through therapy and it may or may not work for one or the other reasons. And now I practice as a registered hypnotherapy and I serve gay men in successful careers. So now, when we talk about therapy worked and it did not work, I think it's a lot of vague language. And before we start thinking about why therapy did not work for us or for you specifically or for me, it's really important to start with the definitions. When you go to therapy, why did you go to therapy? And let's say you want to feel better. What does it mean? What does it mean? So, the practical step here is actually find a definition, a working definition for you, not necessarily from the Wikipedia or from American Psychological Association, for you specifically, what healing and recovery looks like for you. Share with you SAMHSA definition, and it's really holistic, extensive definition of recovery from alcohol, from substance use and mental health illnesses. So it's going to combine both together, and I really like that definition. But for you, it's really defining what healing and what recovery means for you. So if you think, well, I just don't want to feel that way, how do you want to feel? I just want to feel better. What better looks like? Does better look like that you start engaging with people in a meaningful way? Does better look like you are more better performing at your job or in your business or in your life? You have this drive and interest and curiosity to live. Does better look like you, like, maybe it is substance related? Maybe better for you means, okay, I don't go out every weekend with my friends and spend a bunch of money on just partying and drinking, and I'm actually investing into something more. Or does better means finding purpose, like higher sense of purpose? And this is especially true for people in high demanding careers like doctors, lawyers, software engineers. When you made the financial aspect, when you are safe financially, you're making your 150 to 100K per year or in the ballpark, but then now you actually in a safe place psychologically and physically and emotionally when you feel provided. But what is next? So working definition of the healing, what healing means. And the working definition can be working definition in the moment right now. So that's the number one. So when I work with people, and the way I work with people, I apply clinical hypnosis and motivational interviewing, like the other way around, motivational interviewing to understand, to actually define that working definition of your healing, of your recovery, of your next step. What does it look like? What does it look like? It can be something big, it can be something small. And I always like, I provide rather rapid, short-term clinical hypnotherapy course that it's 8 to 10 sessions, and then we'll readjust and see if we need to do it more. And within 8 to 10 sessions, this is actually really good window for us to start small and see, okay, where are we? What is the goal? What is the end goal? Okay, I am not emotionally hooked after my divorce, for example, or I'm not I allow myself to say no to partners or potential partners that don't match my boundaries, don't match my morals, don't match my focus. What I mean, that's what it means. And another thing about recovery and why therapy works or doesn't work, it's therapeutic alliance. It's your relationship with a therapist. If you don't click with your therapist, if you don't like your therapist, if you don't feel connection, maybe your therapist is way too formal, way too cold, way too impersonal, really nice, and you have nice progress going and you have insights, you intellectually realize that you might be better or you're feeling better, but still something is not working. That might be due to therapeutic alliance. In majority of therapies and modalities, clinical hypnotherapy, talk therapy, DBT, CBT, whatever, like the whole alphabet soup in therapeutic modalities, they fail because there's no connection. There's no relationship between a client and the provider, person who provides therapy, including clinical hypnotherapy. If there is no connection, clinical hypnotherapy won't work and won't be as efficient, especially when we're doing with unconscious mind, because your unconscious mind controls your breathing, controls your digestive system, controls your automatic movements, right? It's really high alert. And if deep down you don't have connection with that person, hypnosis won't work for you like any other modality. Also, if there is a no concrete working definition, like what we are going towards or what we're going from and towards, then there there's no success. And this is why therapy fails. Lack of definition, what success looks like, what is the goal, therapists holding you and themselves accountable for that goal, you moving towards that goal together, and you checking in, are we there yet or not? And if we're not getting there, why we're not getting there? Is it between us? Is it not the right fit? Do we not have connection? Do we not have deeper relationship? What is the problem? Now, to help you with the definition, so let's look at actually SAMHSA definition of recovery. I really like that definition. I will link the link in the description. So this is the wheel: hope, person-driven, many pathways, holistic, peer support, relational, culture, addresses trauma, strengthen responsibility, and respect. So let's just go one by one, right? So this is the working definition. I will not read the whole file, but it starts with health. And health starts with healthy choices. It specifically talks about substances and specifically talks about informed decisions, what substances use or not use. Because when we are after divorce, if we're going through the divorce, if we're going through difficult times, if we're managing stress, sometimes we use substances, coffee, nicotine, weed, alcohol, just to pick the socially appropriate substances. It's not necessarily something big and horrible, although big and horrible also happens, like cocaine, crystal meth, fentanyl, other substances people use as substances. But health, it starts with health. It starts with informed consent, what you are not going to put in your body, including the foods that no longer serving you, including the healthy, like healthy substances that help you to recover. I'm not talking about psychoactive substances. I'm talking about maybe it's tea, maybe it's improved diet. Home, stable and safe home to live, quick and easy, because this is, and I know a lot of people with high demanding, it's not like that you are experiencing, I don't know, homelessness, but is your home stable? Stability in your home, and stability in your home can look different. Purpose, meaningful daily activities such as job that you enjoy, that brings you meaning, school, volunteerism, family caretaking, creative endeavors, and the independence, income, and resources to participate in society. Maybe income for you is not an issue. Like you are software engineer, you are an entrepreneur, you are a medical doctor, you have successful career, or you're account manager. Do you have purpose and meaning in your life? Community. Listen, I cannot emphasize this enough. Healing and recovery doesn't happen in clinical hypnotherapy session, doesn't happen after motivational interviewing session when we do our pre-talk, when we actually implement the positive change and strengthen it with clinical hypnotherapy without the community. And this is probably one of the challenging parts. If you go to therapy, if you do the work, but you don't have people who support you, you don't have the community, that can be problematic. And this is 10 principle of recovery. So how do that you are getting better? So what this is cheat sheet for you. It's hope. It's relational. It's person driven. It's culture. Many pathways. Talk therapy didn't work for you, try clinical hypnotherapy with personalized coaching and motivational interviewing. Maybe that will work. Maybe you try therapists who are not from LGBTQ plus community. They're wonderful therapists, they have credentials, they have license, but they're not gay. They're not gay men for you. So try different. Try a gay men therapist or try a gay men hypnotherapist. And it can be me, it can be somebody else. If I don't resonate with you, don't go with me, because if we're not clicking, it won't work. But if it resonates with you, might as well try. Holistic. Holistic means like it's the whole person, right? Like peer support. Do other people in your situation that can relate to you. Cultural component is really essential, and this is why in on my website, if I have not already, I will post a few different specialties, including clinical hypnotherapy for Black gay men, including clinical hypnotherapy for immigrants. And doesn't mean that I'm excluding people from majority culture, like white gay men. It's not what it means. It means that culture is important. As a Black gay man, your cultural experiences within the community is quite different than maybe my cultural experiences as an immigrant, as a white person immigrant, as a person with Turkic background, that people don't know what a Turkic background means, right? Who is Tatar? Like people think, oh, Russia, white Russian, maybe Ukrainian, but Tatar, what is Tatar? What are Turkic languages, right? For you, justification, discrimination within the community, racism within the community, sexualization, fetishism. But this is the culture, like healthy culture around you, and choosing healthy culture around you. People who can support healthy culture addresses trauma. Listen, we as people, as gay men from devalued identity, means that majority culture devalues our identity, thinks that we're less than. We have trauma. Sometimes we process it and it turn out as resilience and good for us, really good for us. Like a lot of gay men in successful careers in businesses, super resilient, good for us. Strength and responsibility. You have to keep yourself responsible for your own shit. You have to be real with yourself and respect. And it goes into, it kind of like breaks it down, like person driven and kind of what we talked about, right? And you can read it yourself. So this is what it means to heal. This is what working recovery, this is the working recovery definition. Now, if talk therapy did not work for you, we, from SAMHSA definition, we saw many pathways, meaning you are allowed to try different modalities. You are allowed to try clinical hypnotherapy with personalized guidance and motivational interviewing, which I provide. Try it out. Go on my website. You can read about my background. You can read about my education, where I went to school, my professional background, that I work a lot with gay men and also persons with disability and critical illnesses, right? I work with a lot of people who went through really, really hard experience. And oftentimes I met people in the worst point in their lives. I'm not even kidding. In Russia, in my private practice, when I was practicing at public mental health places, in the US, when I was working at homeless shelters or at homeless shelter as a youth counselor, when I was working as a social worker, when I was working as a case manager, right? I do have the receipts and experience. And this is why I created my private practice specifically for gay men, because there are many different paths to recovery. And I would like to bring my expertise with clinical hypnotherapy, evidence based clinical hypnotherapy. This is not a mind trick. I'm actually also shared that on my website, what American Psychological Association says about hypnotherapy, Yale Health Institute, what they say about hypnotherapy, and also broke down my process. Is not just you're not just getting hypnotized. You it's a guided process. It's guidance and coaching and clinical hypnotherapy. Like motivational interviewing is for like really start working on your change and using your motivation that you may not be fully aware of yet, and clinical hypnosis as a strengthening path. And I'm always goal oriented. If your goal just, hey, what, I just want to do maintenance work and just go to like hypnotherapy like once a week just to feel good, what is on the other side of feeling, what feel good actually looks like and how can we maintain. But normally I will hold you like responsibility and accountability. I'm rather direct, and I will hold you accountable in the loving, accepting way. I will hold you accountable. So it finally starts working. I'm not afraid holding my clients accountable, because if we don't real with ourselves, we cannot heal. The way you can book appointment with me, book 15-minute consultation, and it's free. If it is a good match, I will send you the link. I will send you the paperwork or with simple practice, and I will send you the link to book your first hypnotherapy appointment. All the pricing, the links you can find on my website, goodhypnotherapy.org, and check out for yourself. I recently updated my website, and I constantly updating it. I'm in it. I edit blog with vlog. I'm like kind of, if it's hard for you to sit through the video, like there's a written version of my YouTube videos, some of my YouTube videos, so you can just skim and read through it if you don't want to watch it. So plenty of resources. Go to my website and book a 15-minute consultation if it is resonates. If it doesn't resonate, if you're like, yeah, I'm not sure, like it's probably not for you. If somebody else resonates with you, book a consultation with them. Absolutely, because many different pathways. I love you so much. Thank you so much for watching, and I will see you in the next video. Bye, y'all.